Talking about the workers factors, it can be said that there can be genetic factors, it can be related to the race, gender, age, lifestyle, and even the medical histories of the workers working over the place, working in their workplace. And talking about the workplace exposure, it can be said that there are certain exposures which are, counted according to the magnitude of the exposures which is being produced for the worker, and even the duration counts and the timing and even the physical properties of the hazard that we are considering. So talking about the occupational hazards, there are basically 5 types of occupational hazards, that are physical, chemical, biological, mechanical, and psychological hazards. Now, talking about the occupational safety and health, which is definitely a very important issue to be focused on, to be dealt with, and to be taken care of. So there are certain factors which are focused according to the numbers, like according to the priority levels, they are focused. Talking about the factor number 1, which is focused primarily, is when we make an analysis of occupational disasters and safety improvement technologies. Talking about the second factor that we basically focus on is how to produce workplace safety management and intelligent monitoring for the worker. And the third factor can be said as, taking a study and an evaluation of the epidemiological situation, and considering the factors of how to prevent the diseases which are produced in the workplace, which can be harmful and hazardous to the workers. And another factor which is taken care of is, how to monitor the workplace health, and first of all monitoring, and then in turn all managing the environment. And another factor which is focused on is how to make an assessment and prevention of human factor and physical danger which can be caused to the workers working over
1
there.
minute, please.
And the last factor which is yeah.
The person who's sharing that screen, please stop sharing your screen. Thank you very
Should
much.
I stop sharing my screen?
No, not you. Someone else was sharing that screen. Mrs. Reet, your screen is not, your slide is not moving on the screen ball.
I'm sorry, what am I supposed to do?
Like, for example, when you share the screen, you have to go to the slide and be moving it. We'll still be seeing you, but you won't see yourself.
Is there any problem with my sharing of the screen?
Yes, it was not moving.
It's not visible to you?
Now it's not visible. Can you please reshare it? Let's see.
Okay, I'll just reshare it. Okay, once let me
Okay.
just stop sharing the screen. Is it visible, this page? Is it visible to you?
It's not visible to me now. We are just seeing you.
Not visible. Okay, just a second. Just a second. Let me just go through it. What exactly is the problem? Okay. Now?
No, not yet. Let me see. No, not yet. Okay,
Not
now
yet.
it's
So,
coming. It's coming now.
now it's coming.
Yeah, it's
Yeah,
there.
okay. So I think my slides were not visible to you all by the time I
Yeah.
was reading. Yeah, okay. So if you don't mind, I would just like to go through them all over again.
Okay, no problem.
Okay. So let me just start with this again. Okay, talking about the environmental health. So basically, environmental health is what? It is the health which addresses the assessment and control of the environmental factors which can potentially affect the human health, and it is targeted towards 3 factors, that is how to prevent a disease, how to create a positive human behavior, and how to encourage it up, and how to create a healthy supporting environment for the workers and all the people who are surrounded with. Okay, so proceeding to the next slide here, I have the types of the environmental health hazards. So basically there are 4 types of the environmental hazards, that is biological, social, chemical, and physical. Talking about the biological hazards, it can be considered that viruses, bacteria, and many other multiple microorganisms can cause diseases. And talking about the social, it can be said that the daily choices in our lifestyle which we make in our daily lives is all that can end up endangering our health. Talking about the chemical factors, there are many harmful artificial as well as the natural chemicals in the environment that we're exposed to, and unknowingly they can end up costing our lives. And talking about the physical factors, there are many natural disasters and the ongoing natural phenomena like the increasing UV radiations that can cause health problems like cancer and many other problems. Now it's visible when I'm going through slides.
Yes, yes.
Yeah. Okay.
Hello?
Okay. Okay.
Yeah.
Yeah.
Hello? Yeah, Mr. Visha, you are going too fast.
Okay. So I need
Are
to
you
go a
getting me?
little slow. That. Yeah. 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 Yeah.
Yes, you need a little bit slow down.
Okay. 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 Because I'm just scared about this internet connection. I don't know. Okay. So there are
Okay.
four major, yeah, there are four major environmental hazards, that is the pollution, global warming, deforestation, and soil erosion. Talking about the pollution, we know there are certain types like the air pollution, water pollution, noise pollution, and the soil pollution. Global warming, which tells us about the increase in the carbon dioxide in the environment, which ends up with the factor of the ozone layer getting decreased, and the deforestation, that is the constantly cutting down of the trees because of the industrialization and many other factors, due to which the oxygen concentration is getting decreased in our environments. The soil erosion, due to which the topsoil is eroded. Now, this was all about the environmental health. Talking about the occupational health, it can be said that it represents a dynamic equilibrium between the environment which a worker gets in his workplace and the environment which the like equilibrium between the inside of the environment of the worker and the workplace which he is exposed to. So this is about the occupational health. Now, talking about the objectives of occupational health, there are certain objectives like it basically prevents the occupational diseases and injuries, and also it is focused on how to maintain and promote the physical, mental, and social well-being of all the workers who are working over their
I'm not
workplace.
hearing the presenter any longer. Hello?
Yeah,
We are sorry, she's speaking and we are hearing her.
Hello?
Try.
I'm sorry, what?
He said he was not hearing you. We are
Can I
sorry,
continue?
we are hearing her. Probably it's from your
I'm
phone.
not hearing the presenter, please. I'm not
It's
hearing
your
you.
internet. It's your internet. We are hearing her. It's clear from us here.
Is there any kind of problem?
Yeah, he's still facing problem hearing
It
you.
is clear. It is clear to some of us. It is very clear to some of us. But probably it is a spoon.
Okay, please,
Okay,
if
please.
anyone is having
Again,
problem, please write in the chat box. Don't stop the presentation in the middle. It's very bad, seriously, please. Just write in the chat box or you can raise your hand and we will message and solve your problem. Please do that.
can I continue?
Yes. Sorry for that.
Yeah, not a problem. Okay. So, talking about more objectives of the occupational health, basically it can be summed up as it should be preventive rather than curative. Now, talking about the occupational health hazards, the work-related disease can be, taken. It can be classified as the two factor under the two factors, that is the workers factors and the workplace exposure. So, as the name itself tells us, how the workplace exposure acts as a health hazard for the worker, like the physical properties, the magnitude, the duration, the timing, the multiplicity. So all these factors, they add up to how the exposure is making an effect as a health hazard on the worker, on the health of the worker. And talking about the workers factors, it can be said that it can be related to his age, to his gender, to his race, to his medical histories, to his genetic factors, and to his lifestyle. And there might be many other multiple factors which can end up, you know, uh, affecting the worker's health. So, talking about the occupational hazards, there can be five types, that is the physical, chemical, biological, mechanical, as well as the psychological hazards. So, all these factors, all these hazards, they are, they need to be taken care of, they need to be focused on, and they need to be dealt with very, proper care. So now talking about the occupational safety and health, which is like a kind of an alarming need for today's life, is when we put our focus on different factors which are to be dealt on a different level so as to bring out occupational safety in a proper way. So talking about certain factors, let me talk about the focus number one. That is when the analysis of the occupational disasters and the safety improvement technologies is being done. Like how can be the safety for the workers can be improved? How can that management be done? Then the second factor is when we have the intelligent monitoring of the workplace safety management. Okay, like first of all coming up with the idea, then monitoring the idea, then going on with the management. So this is what the second focus deals with. And the third focus is when we have the study and study on epidemiology and occupational disease prevention. Like how can we just prevent the diseases from happening? And the fourth factor is when we have the proper monitoring of the workplace health and then the management for it. The fifth factor is all dealing with the assessment and prevention of the human factor and the physical danger related with the health of the workers. And the sixth focus and the sixth number factor is when we have the focus done on how to reduce the exposure to the substances which can prove harmful or hazardous to the human health, and thereby coming up with the preventive technologies for it. So this is how the layout for the occupational safety and health system is being carried out. Now, talking about the environmental and occupational health hazards, it can be said that increasing research shows a relationship between the environmental health, reproductive, and children's health. And in my further slides, I'll be talking about this in detail, like how the reproductive, the children's health is being affected because of these health hazards. They affect the health, causing many neurological disorders, allergies, and behavioral changes, and many other factors. So, the reproductive and children's health, it can be, impacted in various ways, causing a number of disorders. Like there might be increased chances of miscarriages, birth impairments, premature births, cancer in the reproductive organs, and many other disorders which can be caused because of the exposure to these health hazards. Gonads, they might be damaged by the pesticides, chemicals, or other exposures, and they can affect embryos development. And the toxins, they can be transferred to the breast milk. And one very important line is what I have put in my presentation is there was a survey done that the president's
Hello?
cancer. Yeah.
What happened to this stuff? I'm not hearing the speaker. If you think it's listening.
Do you hear me?
Yeah. Excuse me, am I
Hello?
supposed to stop in between or
No,
something
not
like that?
you.
Hello?
Do you hear me?
It's creating a lot of confusions. I don't know. Okay,
Yeah,
I would like to
really.
continue. Yeah. So this
Please
President's
continue.
Cancer. Yeah. Thank you. President's Cancer Panel found out that there was an approximate number of 300 chemicals which were present in the umbilical cords. Now, with this estimate, with this data, we can just estimate how, yeah, on a very large scale, this health hazard is creating a problem. See, if this chemical is found in the umbilical cord, then you can have an idea of how much is it costing a life. So this was a very important data related to this. And it's like due to a more vulnerable immune system, physiology, and metabolism, children are at a greater risk of damage to the nervous system, brain, reproductive organs, and endocrine system. As the amount of concentrated chemical rises, so do the number of childhood illnesses such as leukemia, brain cancer, and other cancers linked to the environmental carcinogens. Now, here's the slide where I mentioned the types of hazards. Now, first, I would like to talk about the very important hazard, that is the radiation. So, the radiation exposure is of two types, ionizing and non ionizing radiation. Non ionizing radiation is found in the microwaves, electronics, and voltage line waves. Ionizing radiation exposure is due to the nuclear power plant emissions, uranium mining, weapons testing, and medical technologies. So this is how this is where I've shown about how much damage is being caused. Like it's found to be the longest established environmental cause of breast cancer in men and women. It can be seen easily that there are some acute damages as well as there are some long term or the chronic damages which are caused due to the radiation exposure. Talking about the acute damages, it can be seen that death, skin burns, sepsis, sterility, and GI and the metabolic complications they are caused. due to the radiation exposure. And talking about the long-term complications or the damage is, cataracts, cancer, life shortening, malformations, and circulatory diseases problems. So this is how much impact a radiation can have on a human health. So it's now talking about the exposure to mercury. Even small amounts may cause serious health problems and is a threat to the development of child in utero and early in life. Mercury may have many toxic effects on the nervous system, digestive system, and immune systems, and even on certain organs like lungs, kidneys, skin, and eyes. Mercury is considered by WHO as one of the top 10 chemicals of major public health concern. Neurological and behavioral disorders may be observed after inhalation. Dermal exposure of different mercury compounds can also end up costing the life. And there are certain symptoms which are elevated due to this, like which can include the tremors, insomnia, memory loss, neuromuscular effects, headaches, cognitive and motor dysfunction. And here in this picture, we can see how the mercury exposure is enough to affect health in a very, very dangerous way. Like eating contaminated fish and shellfish is toxic to the brain and in turn in turn affects the brain development in the unborn babies and the young children. Using certain skin lightening soaps and creams is toxic to the kidneys. I told you, it ends up affecting almost all the parts of the body. Mercury is used in small scale gold mining. This form of mercury is toxic to the brain and also to the kidneys. The same applies to the mercury fumes from broken thermometers and blood pressure devices. So there are many sources from where we can get the mercury exposure, and here I have listed all the hazardous effects which it can have on our health. Now, coming to the next factor, that is lead. Exposure to high levels of lead may cause anemia, weakness, and kidney and brain damage. Very high lead exposures can cause death. Lead can cross placental barrier, which means pregnant women who are exposed to lead can also expose their unborn child. Lead can damage a developing baby's nervous system. Even low level lead exposure in developing babies have been found to affect behavior as well as intelligence. Lead exposure can cause miscarriage, stillbirth, and infertility. Generally, lead affects children more than adults. Children tend to show signs of severe lead toxicity at lower levels and as compared to the adults. Lead poisoning has occurred in children whose parents accidentally brought some amount of lead dust on their clothing. Neurological effects and intellectual disability have also occurred in the children when parents may have job related lead exposure. Talking about the pesticides, that is the most common and utilized synthetic product. 1.2 billion pounds used annually in US, 5 billion worldwide. If exposed to pregnancy, can cause barrier autism, can cause brain autism. Exposure has been linked to developmental problems and reproductive complications, which can include menstrual dysfunction, decreased sperm count, early puberty, delayed testes, abnormal ovary function, prostate and penis developmental problems, infertility, miscarriages, stillbirths, etc. Now, I skipped the slide. So this is how the pesticides exposure is being shown in this picture. Now, the endocrine disrupting chemicals which are found in the pesticides, that is the bisphenol, this is the material which is used to make plastic, and even can include some cosmetics, flame retardants, glues, and cleaning products. Fat soluble, they accumulate in the animal fat and animal products, and when they are consumed, they they pose a very high risk due to the increased body fat. Exposure affected by the indoor air quality. Example might include the diethyl synthetic estrogen. They have shown high miscarriage rates, vaginal cancers in the children of pregnant DES users. That is the endocrine disrupting chemicals. And here there are certain pictures or seen shown in this slide. These are all the endocrine disrupting chemicals. These phthalates, flame retardants, dioxins, phytoestrogens, and all. So now in the end, it was like in all the slides we talked about how the different health hazards, they possess a very dangerous situation for all the workers and all the other people who are in one or the other way affected or exposed to the environment. So it can be said that the occupational safety evaluates the safety and provides interventions to reduce the risk of injury and illness, using ergonomics or the human factors and wellness for the future, current, and past workers. Now, in the end, I would like to say that we must spread environmental awareness and protect our environment from all the hazards. In my view, it is the responsibility of everyone to do our bit for the environment. Therefore, let us all just work together towards a greener and more sustainable future. Thank you. Regards.
Wow, that was great. Thank you very much for your presentation.
Thank
Um,
you so much.
Thank you.
Thank you very much. So, thank you for the clapping. So, those of you who have questions, you will have chance to ask your questions. But first, let's
Thank you.
try
That
to
was
get
so
to
much. I much appreciate.
those that are having problem hearing us. Is there anyone having problem to hear?
And also,
Yeah,
I
I was having problem,
would
but
like
yeah, now I work on it.
Okay, thank you very much for doing that. Please, if you're having problem, you can either send message in the WhatsApp group or just send message in the chat box. But if you open your mic and speak, it will disrupt the presentation. And also, you can also rewatch the video from our YouTube. We are going to edit it and post it there later. And you can also feel free at any time to get back to us for the recording. So now, it's question for at least maybe 10 or 15 minutes. You can ask your questions if you have.
Yeah. And also, I would like to extend my apologies for all the internet network problems that I had. I don't know.
Actually, we didn't feel that problem from your end. I think it was perfect. Like Google Meet is better when it comes to internet. It's not like Zoom. All right, if
Yeah,
you have a question, okay, ask your question.
yeah. Thank you very much to the presenter. You did extremely well. I must
Thank you.
appreciate you.
You.
Yes, I'm Lawrence Williams from Liberia. And you were discussing occupational health and safety, and
Yeah.
listen to
You
you
don't get that? You don't get that? You don't get
carrying.
that?
Emmanuel, please.
You don't get that? You don't get that? You don't get that? You say, yeah, you don't get that?
Now you can
Hello?
continue.
Yeah.
Yeah, where you were talking something about the ozone layer, the ozone, right? The depletion of
Yes.
the ozone. We really want to know, I mean, what to what extent does the ozone layer protect us? Like they have the two type of the ozone layer. To what extent does the ozone layer protect us in the environment?
If I could get your question correctly, it's like you are asking to what extent can a person prevent himself or herself from the exposures, right?
Yes, about the
Um, he,
ozone.
he said to what extent the ozone layer protects us as individual.
Okay, it's like whatever the amount of ozone is present in the environment, it's at least 2.5% of the population is being protected because of the ozone layer. So as the amount of ozone gets decreased, it's definitely a very alarming problem for all of us, right? Because as the amount of ozone layer is continuously decreasing, the amount of carbon dioxide is increasing in the environment. So this is definitely a problem which is which needs to be focused on, which needs to be dealt with a very proper care, because if it's getting decreased every day, so this is when the amount of oxygen is getting decreased because of the increasing amount of carbon dioxide, and we all know how dangerous can that situation be for all of us. The increasing amounts of these gases and all many other, see, carbon dioxide increasing, carbon monoxide, and many other compounds, the compounds and gases, they're going to be increased in the environment. And that is when the rates of cancers, the skin problems, the reproductive health problems, and many other problems which I even listed in my presentation, they're going to be very high for all of us. So this was what. Hello.
Thank you.
Yeah.
Are there any further questions? Guys, please ask your questions if you have.
My hands up.
Hello.
Okay, you can unmute your mic and speak.
Yeah, my question is Agara. Is there still a
Yes.
hole in the ozone layer?
Sorry.
Do we still have a hole in the ozone layer?
Yeah, we still have a hole in the ozone layer, and that is what I call to be an alarming problem for all of us.
Oh. So
Yeah.
what are some things we can do to help stop the damages to the ozone layer?
Yeah, there can be many preventive measures which can be taken so as to decrease the hole, or not to actually increase the hole or decrease the ozone layer concentration. Because like the if the deforestation rates go down, if the soil erosion rates are being decreased, if the pollution in the environment, may it be air, water, soil, or whatever, if the pollution rates are getting decreased, so these are some preventive measures which can be taken so as to help preventing the ozone layer.
All right, thank you.
Yeah, and with this, increased rates of the industrialization, the lands are being cleared, the trees are being cut down, certain industries in high amounts they are being built up, and lots of exposures of different gases are being produced in the environment, and that is how this whole is getting, you know, uh, is being formed. So this is
All
all we
right,
need to take care of. Yeah. Thank you.
all right, thank you.
Thank you.
Okay. Another question?
Yeah,
Okay,
like
continue.
we are still on the ozone layer, and I want like as individual, because the ozone is different as per places people live. Like for Liberia, you can compare the ozone layer of Liberia to that of people living in Europe. So because the environmental activities are very different from the two countries. So like in Africa, what
Yeah.
what do you what do you think are some of the individual contribution that we can make individually to help the ozone layer? What are some individual contribution you think we can make?
Okay, so I would say that it doesn't matter from which region we belong to. Whatever country, whatever region we are in, we can make our individual efforts so as to come up with a proper solution for this. So on our own level, making some appeals to the government, okay, government of our countries, and making some efforts like organizing camps, or in any way, you know letting people know, making people aware of getting down the rates of the deforestation, of decreasing the amounts of the industrialization which is being done in the countries. So these are certain small factors which, if made individually, can form up a very big effect. And decreasing the
Okay.
rates of pollution, like decreasing the amounts of usage of plastics, and growing more and more number of trees, and it's all about letting people know, making them aware of how their individual efforts can add up to this big problem solution. So it's like the individual efforts can be these only.
All right. So we take at least two questions and then we close up.
Yeah, I have a question.
Yeah, sure.
Hello.
You get
This
me?
is Ezekiel.
Yes, Kelly, we are getting you.
Yeah, from the presentations, she make mention of four major environmental hazards. She talk about
Yeah.
Yes.
pollution, global warming, deforestation, and soil erosions. So my question
Yeah.
have to do with what would be the advice as a public health student in controlling those environmental hazards, and what are the implementation to solve those environmental hazards?
You're asking about, like, again, like same kind of question, like the individual efforts which can be done to decrease the environmental hazards. So did I get your question correct? Is this what you're asking?
Can you please like summarize the question? What did you say?
My question is, What would be
Okay.
the advice as a public health student or professions in controlling environmental hazard?
Yeah. Okay, so I think my answer is going to be the same for this one, because the environmental hazards, they count the same. That is the increased amount of air pollution, water pollution, soil pollution, the increased amount of carbon dioxide in the environment, due to which global warming is increasing, the deforestation. So the efforts are going to be the same to, the approach is going to be the same to solve this problem also, to less to bring down the occupational I mean the environmental hazards. We as the individuals, or we as the responsible and the aware citizens of our own countries, we can make appeals to the government to come up with certain laws to just bring down the deforestation rates, to put a ban on the factories which are producing many chemicals in the environment. So this is how the efforts are going to make a difference, right? If the government comes up with a law, like putting a ban on some industry and just limiting the amount of the exposure which can be produced in the environment, so that is how the exposure is going to be the, less in the environment. And ultimately the hazard is going to be less. And the soil erosions, for this we can promote more and more growing of the plants, and not just clearing of the lands for industrialization and all. So I think the efforts are going to be the same. Letting people know is all the solution is about.
All right. Thank you very much for the answer. We
Yeah,
take one
hello,
more question.
Hassan.
Yes.
Yeah, Hassan,
Yeah.
how are you? This is Ezekiel.
Yes, Ezekiel.
Yeah, I'm so sorry. First of all, yesterday I was not changed to form part of the introduction. So across
Okay.
in Guinea, I still maneuver to get a SIM card, and but the network could not still permit me because I still route from Ligeti to Longowa. So I missed yesterday's section. I wanted to ask a question whether this presentation will be given to us, soft copy or maybe the video. I don't know whether it will be shared with us.
Yes, currently we are recording the video, we are recording the presentation, and we
Okay.
might share later based on the facilitator. We will ask them if they give us permission. We'll share it on our YouTube page or on our website. You can get it from there, and they will send out their slide. You can read them later.
Oh, the slide will be available.
Yes, sure.
Okay, thank you very much.
All right. Any
Thank you
question
so much.
for the presenter?
Sorry.
I'm asking them. Any question for the presenter? All right. If there's no question for her, I think we will summarize here. Firstly, we'd like to say a very big thank you to her for taking upon herself to accept our invitation. We know it's very difficult to, take your time and prepare a presentation to present to people you don't know. So we want to say thank you very much and congratulations for meeting some young African from across Africa. Thank you very much for being with us, and we are very much grateful. So now we'll take at least 2 comments or 3 comments from the participant, maybe a thank you comment or something you want to say to our facilitator. Two, one from the male and another from the female. The female, please talk. You have a female from another country presenting to us. That's very great. So please talk. She wants to meet you. So any comments? Asha,
Yes.
Asha, Fanta,
Okay.
are you guys there? All right. Okay, Asha. We need a comment from you.
So thank you for your presentation. I really hope to learn more, get to do other projects that involve occupational competition. Yeah,
All right. Thank you. Though we didn't get you clear, I think you are working, so no problem. So we take another comment. Fanta will come back to you for a comment. Someone mic is open. You can give a comment.
Yeah.
Yes, Lawrence.
I just want to I just want to take this time to appreciate her. She did extremely well more especially places that she touched. Very Kima admiration. Highly appreciate her. She did extremely well. I wish that she always be with us most of the time, to present on things that she have expertise over, so that our knowledge can be brightened before the ending of this particular training. So thank you, Madam Rachel.
Thank you so much. Thank you. It was really a
Okay.
good time with you all.
All
Thank you.
right. So thank you very much. Actually, we should have had more than this amount of participants. We expected at least 70, but I guess everywhere around the world we have people who face problem with internet. So some will can't in and go out. Some probably they are not online and they didn't check their email or their WhatsApp. So it's kind of very bad. And some are from different countries. So the time difference is very difficult to get to know the time. But anyway, thanks to those that participated, and thanks to our presenter. Thank you very much, Madam Reed. And we hope next time you can be with us for another presentation.
Thank you so much. Thank you so much.
So I will send you a message and
Okay.
we'll see later. Can you please send the slide to our email?
This presentation?
Yes.
Yeah, sure. I'll send it out.
Okay. Thank you very much.
Okay. Thank you.
Thank
Thank
you.
you so
See
much.
you. 1 minute.
All
Can you
right,
guys
thank you.
Yeah.
please open your videos? Let's take picture.
Sorry. Okay, let's click a picture.
All right. Picture is taken. Thank you to everyone for joining us. All right. Please stay here for the next presentation.
Okay. Should I share it up like the last page?
Yes.
Okay. Just a
Like we
second.
want to share it on our website, so
Yeah,
you
yeah.
have to be
Sure.
showing that you are the one that presented it, that has it.
Yeah. Just a second.
But hello.
No, I mean to send it the next presentation.
Okay, next. Oh my God, I'm so
I
sorry.
think
I just
I
thought
think
you were asking for the last one.
I think we need this class. I think we need this class in our mail.
Yeah, when she
Yes.
sent to us, we'll send to you.
Okay. Thank you.
Our next facilitator will be with us soon, and the presentation from Madam Reed was very good. Learn a lot about mental health and environmental and occupational health, and we are very much grateful. So she took upon herself to be here with us, and she did her best extremely well by giving us such good knowledge. So please talk to your friends tomorrow to join us. It's very bad that they are missing such an opportunity. And our next presenter will present on introduction to public health, and he will be joining us soon. In the meantime, I would like to talk about the assignment issue. That is the projects. If you observe, we didn't send you mail with your groups. That was because many people have not yet filled the form. So if you're interested, I repeat again, if you're interested in taking part in the project development, please start to fill the form. We'll reshare the form in the group. So tomorrow, we don't have any presentation tomorrow. We are just going to do the assignment tomorrow. We'll come here tomorrow and we'll explain to you how the assignment is going to be. And after that, we'll let you go. Maybe we'll take like 30 or 40 minutes. And after that, we'll let you go so that you can work on your assignment as a group. And tomorrow, you'll get the group members. You will know which group you are, and you guys will decide which project you are going to work on. So please give us a few minutes as our next facilitator will join us. All right, thank you very much. I hope you all saw the video, or you have problem seeing it.
Well, we saw it, but it's okay.
Okay, probably was coming late. Maybe it's due to the internet or some kind of problem. But anyway, thank you for being here. Um, our next presenter is gonna be, all right. Oh, nah. 1 minute, please. I share my screen and cancel it. All right. So our next presenter is going to be Sam and Livingstone. He's a librarian. And he's going to be presenting to us about population of public health. And probably he will add some other stuff there, but let's await him as he will join us very soon. So how was the first presentation? Any comments?
Yeah, the first presentation was okay. It's just like,
Okay.
yeah, today is my first day, but I'll try to like keep up. Maybe I will get to you separately to find out from you about yesterday's presentation. Then what I say I was in route from
Actually, yesterday we
internet
didn't have
specialist.
anything special. We just did introduction. Like for example, we explained on what to expect from the training, and we talk about that we are going to divide you into groups, and then you work on projects in the various groups. And we also talk about the projects, the types of projects that you will be working on. That the project will be in connection with the SDG 3, which is about good health and well-being. And we also, yeah, we show an example of the project guidelines, like how you're going to be doing it and where you're going to be doing it. We talk about that. But actually, tomorrow also, we are going to dedicate tomorrow to the project. So tomorrow you won't have any presentation. Tomorrow we'll get to a time, and then we'll come here. We'll discuss the project and then give you your assignment. And then we'll also divide you into groups. You go in your various groups and work on your various projects. So let's say tomorrow be a meeting day. You'll meet your group and discuss among yourself on what project to work on. That's all we're going to do tomorrow.
Thank you very much.
So actually, like, forgive our first presenter. Like, she's more of a medical student, so medical and environmental stuff. So more involved in occupational health. So that's why you guys were asking more about ozone layer, but it was the answers were like, I don't know, something you guys didn't expect. So it's more of a medical student. They deal with human brain. They can open your brain and do some things there. So and human body. So Sam will be joining us very soon. Maybe in 5 minutes time, he'll be joining us. Uh, so if you have any, and we'll answer in the meantime before he joins us.
Yes. Hello. I just want to
Ambassador
bring up
Yusuf.
this. Yes.
Yes.
Unfortunately, some of us joined a little bit late, and the first
Okay.
presenter was actually awesome. Her presentation was amazing.
Unfortunately, we lost most of the part of our presentation because of coming in late. So we'll appreciate if the slide could be shared so that we will be able to catch up.
All right, she just sent slide. We are going to send to your emails. Those that are attending now will send to your very emails. And we'll also share the slide on our website. You can check your email and check our website. You'll get it from there. In a few days' time, we'll do that. Don't worry. And the presentation
Okay,
will also be shared. We'll share the presentation on our YouTube. You can also get it from there. All right, guys. We have our next presenter with us. He's a librarian and a very dedicated librarian who is involved in public health and research. Thank you for joining us, Mr. Sam. So his name is Sam M. Livingstone. Currently, he's working as a data manager for the University of North Carolina at the Phoebe Hospital in Liberia, and he's also a great public health researcher and a public health enthusiast. Today, he's going to be presenting to us about the introduction to public health, where he will discuss some key aspects of public health. So I kind of ask you to pay your attention to him. And secondly, if you have any problem with the session, let's say, for example, you're not hearing him, or you want to ask a question, or you went out and you came back in, please try to mute your mic. If you have problem, just raise your hand, ask question in the chat, in the WhatsApp group. If you stop him in the middle and then he comes back, it gets the presenter confused. So please try to be a bit moderate with us and forgive us for any problem. So, Mr. Sam Livingstone, thank you very much for joining us. You're welcome.
All right. Hello, everyone.
Hello.
Hello, how are you?
I'm great. And you?
Wonderful.
All right.
We are doing good.
Like he was talking, my name is Sam M. Livingstone. I'm a public health technician in Liberia. I work with the Liberia Public Health Association on the IPC as the co-chair, a department that work with the Ministry of Health on the COVID-19 when the first hit the country. And currently, I'm still working with them as a volunteer. It is something that calls for service to our people. I'm a graduate of the Cyprus International University in public health. I've also attended a lot of schools. Education have never stopped for me. Every now and then, I'm doing a lot of online courses, like many of you are doing right now. So I'm a classroom instructor. I graduated from KRTDR in 2014. 2010, I graduated from high school to KRTDR. And then I have a certificate in environmental science from Cyprus. I have over 2 dozen certificates from various institutions around the world. That include John Hopkins, through Coursera, University of London, and the list go on. I also hold a diploma in health and safety from Allison. So I hope that the session you guys will listen, get some idea from some of the things that we do. I have volunteered with a lot of institutions, starting with the family planning, that's Planned Parenthood Association of Liberia, PPA, from 2014 to 2019. I also volunteered with the EPA from 2018. That's not full time, but it was something that I called for my service up to the time I started to work with the hospital setting. I'm a peer educator for HIV and AIDS, the National AIDS Commission on Liberia, NEC, and currently I serve as a TA to some other lecturer at the institution. So I don't want to talk much about myself. As you go along in the near future, you will discover many hidden things about me. So thank you, and I want to talk to our CEO, Musa Hassan Kroma, for having the innovation to connect people through this global platform with all having to sit in a real classroom. And in fact, it's a learning opportunity that many of us ought to go for. I pray and hope that some of you will take that challenge. I joined the how you call it, the joint West Africa Research Group, GWAR, in 2019, prior to my graduation, where I started to serve as a data officer until later on when they led because of COVID. I moved on to the University of North Carolina, where I served as data manager on their Lassa fever study in Phoebe. So thank you. I hope that this will be great.
Very much. We're glad
Thank
to
you
have
too.
you with us. Are you going to share a screen, or I should share for you?
You can share your screen, no problem. So are we starting now?
Share, but all right.
Okay.
Presentation.
Somebody.
Are you using PC?
Huh?
Are you using PC?
No, if you wanted to start, I'm ready.
Yes, you can start.
Yeah, then you got a slide?
I'm trying to open it. I have so many windows open on my computer, so it's slow. It's going to open in a few minutes. All right. Share it. I'm put in presentation mode.
Yeah. Is this waiting?
Let me see something here. 1 minute, please. All right. Let me stop sharing this and go to the next. That's much better. All right. So we can proceed.
Yeah.
Just tell me next, then I'll go.
Okay, I believe and think many of you are aware we are doing introduction to public health. So it's a course of innovation, it's a course of collective effort, it's a course of problem solving, and it's a course meant to increase the lifespan of mankind. So as you sit wherever you are, from the comfort of your home, welcome, feel free, ask any question that you have doubt on, then we can go ahead. So next. Are you there?
Next. Yes.
Yeah, next.
Okay, I'm on next. Is it not coming there?
Okay. Okay. So what you will see in this presentation, at the end of this presentation, we hope that you'll be able to define public health, and lists 8 core activities. What are the central themes in public health? What are the do's in public health? Public health functions. All of the major things that we are going to discuss, we have 3 cardinal things that public health really try to portray. You will be looking at them. Recognizing the principal discipline in public health. What are those fees or straight that people can do to be in public health? Describe the difference and similarity between clinical medicine versus public or community health. Discuss some ethical issues in public health, from social, from the lifestyle, from the religious belief to the political aspect. We will be looking at them through all this presentation. Next.
It's going to be a bit tough for us.
So it seems to be like I can present from my end.
Yes, you can do it. If you have a PC.
Okay. Then I think you have to give me the chance to present from my end.
Just you can present and it will do. There is a round box down and there's an arrow inside of the, okay.
Yeah.
Okay, let me stop it.
So hello.
Yes, hello. Like when you go to choose, just choose open window. Don't choose share screen. When you share screen, we share your entire computer screen.
So return.
Like it gives you 3 options. Your entire screen, a window, or a tab. You can choose a tab or.
Let me stop it. Start again. So we come here. The window, right?
Yeah. Choose a window.
Are you seeing it now?
Yes. Yes, you are seeing it.
Okay. So before we can go to the definition, I just decided that this would be necessary. A very brief background. So the history of public health is as old as the history of civilization and mankind. It is dated by around the civilization in Egypt. We will talk about the Indus Valley, in India, in the Mesopotamia region, the Greek and the Roman. So as far as the prophet Moses, Muhammad, and Jesus, they all are key figures in public health. So I just thought it wise to talk something about it before we can get to our topic. It's possible tradition during civilization may be taboo against waste disposal within communal area or near drinking water, right, associated with burial of the dead or doing childbirth. So there was this concept that people had. At the time they were doing those activities, never really knew maybe it was public health. But during our study and survey, we saw that they were taking those, putting those measures in place to see that life would be protected, life would be prolonged, and diseases would be controlled. The issue of hand washing is mainly have been seen demonstrated within other religious cycles of the world. Before you go to pray, you wash your hand. When you come from there, you wash your hand. When you go to bathroom, you wash your hand. So all of the activities that people have been undertaken have been a history of public health. That was just a little synopsis. So now let us look at public health. I will want for you and I to critically look at our own definition, a definition that is able to live with us for the rest of our life. One bacteriologist came up with this definition that is living with us for now, and we will continue with it if we continue to look at it in this direction, and we can even modify them. According to Charles Elwood Emery Winslow, a graduate of Yale University, public health is defined as a science and art of preventing disease, prolonging life, promoting healthy behavior, and the efficiency through organized community effort. Many a time, community will come up with an announcement. We need to clean the road leading to the water side. We need to make sure the hand pump is safe. We need to do something about the way waste is being handled in certain limit. Those efforts that community try to do are all geared toward public health. Another definition other people give is it is concerned with the health of the entire population, not a single person. Its aim is prevention. It protects people, promote the idea that we have from there, and it also restores people's health. So in our era, we have seen a lot of epidemic or outbreak around the world, with example being COVID, Ebola, and Marburg. The military have been used to fight those diseases. It's now a strange phenomenon. It is something that happened way back. If you look at the contagion theory in public health, people with certain disease condition way back during those times, the soldier or the army were used to quarantine those places. They say they barricade those places. People from those areas living from there, not to go anywhere. You have to live here, make sure that we save the greater population. It looks like the community in totality, not an individual having a single disease going to the hospital or the clinic to get treated. As you go along the line, you will see a diagram where you will need to see clinical health, or let's say, clinical medicine versus community or public health. Public health is a combination of skills believed that is directed towards the maintenance and improvement of health for all people through collective social action. Youth group, school clubs can be organized as an implementing force to achieve one of the primary aims of public health prevention. Giving some vaccine to people, someone might be clinical, but it is intended for the entire population. Vaccine cannot be given just to a few set of people, like for instance, the children that are taking the polio vaccine. It is public health effort that has led to the eradication of a lot of diseases many children used to suffer from, and the population at large, not just children. We have the chickenpox, the smallpox, the rabies vaccine that people have taken nowadays, and of recent, the corona vaccine that got a lot of controversy. But those controversies are not strange. It happened before, and people can be able to bring it back. But the greater goals of all of those things is to make sure diseases don't kill our citizens. They don't affect the entire world. They are being able to be controlled, and they are eradicated as time goes on. Another definition given by the ROM, the Institute of Medicine, is public health as what society must do to keep people healthy, and further define it involving the collection of data, the assessment of the problem, and the assuring of health protection for all. It should not be collection of the data just for a few group of people for the rich, and leaving the less vulnerable populations to battle the disease condition. Its advice goes to people in religious sector, people who are non-religious, people who live in certain geographical location or localities, people who may be affected by those diseases that you cannot see. So you need to gather data first. Where is the data coming from? Assess the problem. The clinician will say, make sure you establish a case definition. What are those signs and symptoms that will be able to be equivalent to this disease? So as you look at it from different dimensions, I wanted to look at it from the point of the data collection, the assessment of the problem, and the assurance, which will be discussed later. What is the central theme in public health? What are the core activities in public health? Preventions of epidemics or outbreaks. The major aim of public health is preventions, protecting the environment, the workplace, our food, our water, promoting healthy behavior or healthy lifestyle. Healthy lifestyle might include the food we eat. Are they jungle food? Are you taking exercise? What are those things that you can do to make you live longer? We have STIs around. When having a lot of multiple sexual partners, are you using condom? Being promiscuous in public health is something that we all need to look at. It's a crime, even from other point of view. But we need to see it as a lifestyle behavior that influences our health. Where you live, the environment you live, if it is a bad environment, a bad environmental condition, it also influences your health. Those who live in wetland, those who build in wetland, may have certain disease condition that will be far from those that live upland and don't have downside close to them. Many of you might not have a chance to live in Liberia. Those that live in Winston around the dump site will have certain disease conditions associated with their health as compared to those that live around Mount Barkley. Healthy behavior or the lifestyle behavior, the environment, the workplace. Those who work at a factory where a lot of chemical activities is taking place may likely be affected by, if it is a radioactive activities, than those that don't work in that sector. Monitoring of health status of the population. In public health, we put in this measure by having surveillance officers in community. Someone might say community healthcare volunteers or healthcare workers in communities. Those measures are put in place to make sure they guide and monitor the population as a whole in totality. If there's a single disease outbreak somewhere, they alert the health authorities. Mobilizing community action. In mobilizing community action, there you see the youth gathering up, the youth and the adults in the community gathering up to carry on cleaning up campaigns, school club, cleaning their campuses. Of recent, in our era, we have seen the rise in temperature. We have seen a lot of disasters, flooding. We have a situation here in Banga that we have never experienced before. There was a flooding that lasted for more than 5 days. A lot of people were homeless. People left their home, people who got destroyed. You have to plan to respond to those disasters. Several other countries, we have the Department of the Environmental Protection Agency, EPA. The United States has it, several other countries around the world has it. It is a section put in place to make sure they advise people even on your infrastructure development. You want to build in this swamp. When you build here in the next 10 years, there will be flooding. To build here, you have to meet up this standard. And my brother, we can just say this place is not for perhaps poor people to build. Remember, if you listen to their advice, you say, okay, all of what the guys are giving me, I'm going to build my house in that swamp. You are banking your children bank account, you are opening that bank account straight into the hospital or insurance company. Because every other thing that they will be encountered with tomorrow, they will have to take their real earning to put it directly into that disaster that they are facing. Hello?
Yeah, we are getting you.
All right. Assuring quality, accessibility, and accountability of medical care. Is the medical care that are we receiving, are they of quality? Are they accessible to the population? Where people have to walk about 2,500 miles before they can get medication? Is it something that if we bring the drug supply for the population, would there be report? Are people accountable? Then the monitoring come in. Wishing to develop new insights and innovative solution. If you have this disease condition, the ways of living before, we were like hawking, we were like shaking hands, that was normal. But from the day we have had Ebola, that culture of shaking hands have been tampered with. Corona came, it have further strengthened the public health policy that says avoid handshaking. Avoid handshaking should not only be for the current diseases, it could also be used to avoid common things like cold and fresco, diarrhea. Many times we live in our houses, go to public, put our hand in our nose randomly, and take those same hand and shake people's hand with it. Public health policies and action is helping us to limit some of those activities. The reason those things have been put in place is every disease have the disease trial. When you look at the trial, it should have the pathogen itself, the host, and the environment. Those three things, an attempt to cut one, you cannot spread the disease. Leading the development of sound health policy and planning. We have conducted a lot of studies around your country. We want to make the following recommendations to policy makers or decision makers. It is good that if people are above to give birth on the clinical aspect, say many of the people are giving birth in the society and they are dying, we advise you put the law in place so people will be able to give birth while in the hospital. Are you following?
We are following. We are following.
All right. So most of the action and idea that you see going on are recommendations coming from our friends and partners. So let's look at the functions in public health. There are three main public health functions. One, assessment. Monitor the health status of the people and investigate if there is an outbreak. In outbreak investigation, make sure you have the needed resources. What do I need in this assessment to investigate? In my assessment, I discovered that we are having people are reporting few other signs and symptoms that are not normal to our case that we have here. People are suffering from red eye. People are suffering from severe pain, rashes, itches are coming on them. What do we do? What material do we need? Do we need lab? Do we need an advanced lab for testing? We need manpower. policy development. When you have the policy like the citizen law we have in Liberia, all of the popular law that we have in Liberia, we have one citizen law in Liberia. That law was passed during Madam Salif administration. It says you cannot smoke in the public. The citizen took that law for themselves. You cannot smoke in bus, in taxi, or anywhere. You want to smoke, you go somewhere. So, looking at secondhand smoke, people came out with the law. Hey, you need to help pass the law to help save the larger population from having certain disease condition. In the policy making, mobile lab partnership, develop the policy and pass it on. Make sure you have people of opinion leaders being part of it, assuring. When the law is passed, let us enforce the law. If the law is outdated, let's try to update them. We made a law, the popular law, in 1976. There are certain disease conditions or certain things that are improved in 2021 that need to be updated. No outdated law should be something that we all should look at and we enforce it. Let's take for instance, someone who has STI, a disease condition, should not have a status from somebody they want to follow to be their fiancé. Make sure you provide care and show competent workforce. Those are the three key functions in public health. As you go along, public health is a field that is ever changing. People are doing research every day and things are improving. You may even discover more than what I am telling you. It requires research. In public health, there are several other major disciplines in public health, which we may not give you all. Nutrition, reproductive health. Reproductive health was the first component I saw myself working in public health when I started to serve as a peer educator for the PPA, Planned Parenthood Association of Liberia. In reproductive health, they advise you to control the number of children. It tells you about your sexual behavior, use condom. In reproductive health, it's a state of complete physical, mental, social well-being, not only the absence of disease, other matter relating to A in the process. Nutrition has to do with food, the food intake. Are you eating a kind of a balanced diet? Remember, we tell you, say, when you go, you got the lifestyle behavior that determine your health, where you live, the environmental factor that determine your health, your social cultural behavior determine your health. In the social cultural behavior, you will also have religion, tradition, culture. So those are other things within the major discipline in public health, environmental health. It tells you about several other biological things within the environment, the use of chemical fertilizer. You cannot grow more or harvest more on the plant product and you harvest that thing and carry it to the market. You will be creating a disease condition for people that will destroy their liver because you just apply the harvest more on that product. You took it from just in your garden straight to the market. You have just injected your pigs with that medication. You kill it and sell it in the market. The health education is a concept, an idea designed to teach people about the outcome of health initiative. What are those things that you should do? Who are those that are supposed to be part? And it should be for everybody. Those that are willing and wanting to form part should be health education. Many of our guys will tell you EP, for short, or epidemiology, is a study of disease frequency. How is the disease affecting the populations? How is it occurring? At what rate? At what level? What are the confounding factors? They are the determinant. The confounding factor is it like the social or the lifestyle behavior? Is it the environmental factors where you live? is an autocophonic factor. Is it a belief, your religious belief that is making you like to say the determinant of a disease condition? Pregnant women don't eat crab in certain culture and tradition. You don't have to give certain kind of food to the children. Health economy. The uses of the resources wisely for the maximum benefits of the population. Biostatistics or biostatisticians are people employed to keep records of our problem in the health sector. Some of them in other advanced countries, they use how you call other platform. Like instead of having this old way back medical record, we're using technology to record our ideas, our patients' informations, and the list go on. Health service management, getting to harmonize together and make efficient use of the resources in order to achieve the maximum objective of benefits of the population. Are we listening? Hello?
Yeah, we are listening. For me, I'm getting you too.
Yeah, 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 listening.
All right.
Yes, we are.
So
Thank you.
in public health, we got clinical medicine versus public or community health. What is it? What do they do? Ella will tell you any effort, any attempt, any initiative, any undertaking taken by a group of people to make sure their life. Hello? To make sure their life,
Yeah, we are listening. We are listening.
okay, their life is healthy is public health. The difference between public health and clinical health is this. In clinical health, an
Somebody need to mute
individual
your
will have
mic. Somebody need to mute your mic. The feedback.
the feedback is not good. In clinical
It's
health,
muted already.
you you wait or we wait for an individual to get sick, to have a disease condition, and when that individual goes to the hospital, we are only here to treat that single individual and send them back to the community. In public health, we look at everybody on a holistic level. We prevent, we educate, we create awareness. I am not saying clinical health is bad. I am not saying public health is the best, but I want you to see, and at the end of the day, we'll draw our conclusion for both. Community health refers to a health status of a defined group of people in the area, maybe by government, private or government initiative, which aim is to promote, protect, preserve their health. Whereas I just want to link have the link between community health and public. Where public health refers to the health status of a certain group of people. It can be private action or government action, continue to promote, protect, and preserve life. So, in clinical medicine, is concerned with the diagnosis and treating of a disease in an individual patient. It has involved from primarily medical and nursing service to involving highly complex team of professional, laboratory technicians or technologists, medical doctors, PE, and the list go on. The overall objectives of both public health and clinical medicine is a better health for individual and for society. You got that? The overall aim is we make sure individual citizens are well and public health make sure that the society is okay. Both of them are virtual and interdependent to improve individual public health. They are interrelated, they depend on one another. If we are giving vaccine, we will need clinical health practitioner to give those injection. We will need the public health aspect to create awareness for them. So they both play a pivotal role in our life. But on the overall, many people say prevention is better than cure. Ethical issue in public health. Public health is being viewed by other people as a controversial social movement. Some see it as an eye opener. Some see it as a right to every human, while others see it as a problem. On the other hand, market justice prevention, the fair distribution of burdens and benefit among society. The following are challenges and ethical concerns in public health: political conservatives and public health, or political conservatives and public health. What is it? In this view, politics conserve the broad vision of public health and prefer it to limit into technical expertise, focusing on controlling communicable disease and the safety net providing care to certain group of people. Political pundit, we have it that, oh, this thing is not real. People are only doing this disease to make sure to control certain group of people. Public health will say, no, we are doing it for the maximum benefit of the population. We want to make sure that everybody is safe from the disease that can be is controllable. We are going to tell you simple rules. Set to your homes. Don't live from one region to another. If you have certain time to be home, limit the movement, we will fight the disease. Other people won't see it that way from the political standpoint. Another view would be collective scope and individualism. What is it? Individualistic society resists the notion of public health concern for collective. I, Sam Livingstone, am responsible for my health as a whole, and it should be my responsibility to make sure that I'm healthy. Not a group of people telling me we need to come together to make sure we prevent this thing, the disease condition. Let us work in unity. No. I can work as an individual and make sure my health status is okay. But public concern is the entire generation or entire group of people. He's looking at them to make sure they have this information at their disposal. You need to wash your hand. You are playing with my civil liberty. That's what we will say. You need to wear masks. Wearing masks is another problem. The economic impact. Public health regulation can close companies, create laying off of some workers, the economic impact of burden, close business entity and educational centers. I don't need to tell you more about this. Many of you were in school around the world. You saw this. Those paying for public health benefit may not necessarily be the beneficiary. Example, those that are producing the cigarette, or people may not be willing to pay cost of benefit that could accrue in the long future. Example, to limit global warming, and it's easier to calculate current costs incurred on the public health than the benefit of that could be. Climate change has been one of the controversial topics around the world, even when former President of America, Donald Trump, was not even, let me mince my word, looking at it carefully. What is causing global warming? Oh, we who have the company, we should pay for global warming. What about those that are in Africa? What about those that are in Asia? Would they pay? No. So it's a burden to who producing my car company. We can. Ethical issue in public health look at promoting public welfare versus individual liberty. I have my car. I'm riding my car. Why will you tell me to wear seatbelt when it is I who have the car? In America and other countries around the world, you will be fine for not wearing a seatbelt. They will tell you if you had a seatbelt on, it was going to save you. Promoting public health versus individual liberty. The extent to which government should restrict individual freedom from the purpose of improving community health. Example, HIV and AIDS control in Cuba. Government said, look, the way the thing is happening, we will need to make sure that if everybody want to go anywhere, you have make sure you take your medicine. If you don't want to take it, have the condom. Stick to one partner. Government policy put it in place in Cuba. It became very much controversial. Opposition talk on it, position talk on it, no position talk on it. In paternalism versus liberty, let me just say libertarianism. Restriction on individual behavior for protecting their own health, example, enforcing seatbelt, like I was saying. Libertarianism claims that the only purpose for which power can be rightly exercised and correctly performed is when the person who it should be performed on themselves do it. Not somebody telling him to do it. Drinking behavior to no drinking. You are playing with my liberty. God said you should not. The ethical issue says you should not force it on us, bringing the thing. Government is trying to do something to make money out of it. You will find people when they are drunk, they will harm people against his or her will. Ethical issue, public measures in relation of moral. Public measure. Several other countries around the world, sex education is a taboo in religious setting, traditional setting, and social context in societies. Paul is saying, no, we need to educate our children while in school about family planning. We need to tell them when they see their period, the girls' children, when they should be able to have sex. But this is a topic that when somebody takes, people feel uncomfortable. Father and mother don't discuss it easily in Africa. I don't know about Asia. So Paul have tend to bring religious or moral thing into conflict. The use of contraceptive. Somebody is going to tell you, according to my book, according to my law, I was made to produce. I cannot take contraceptive. I cannot take the injectable, the depot, the whatever. I can't take it. Ethical issue in public health. Ethical issue, values and responsibility. Health authority deciding on value and choice of those they serve. Example, whether someone should take the responsibility on behavior causing ill health, such as smoker, alcoholic, promiscuous people, decision on whether HIV and AIDS prevention versus taking the medicine. So the value versus responsibility. Should we allow people to go get HIV and AIDS instead of them taking the condom? When they get it, they will get any antiretroviral therapy. Is that what we want? Those are issues in public health that will always and continue to see as you go on if you decide to take public health as a future career. Surveillance versus skill. Why do I need people in the community checking my health status? I just believe when I'm sick, I can go to the hospital and get treated. I don't need a healthcare worker coming to my house telling me what to do and what not to do, or telling me how I'm doing. I don't need somebody conducting survey on me or interviewing me, giving me questionnaire. I would prefer treating myself when I had a disease condition. And for now, the last one we have dilemma in cost benefit analysis. Difficulty in valuing life and value to be assigned to the rich versus the poor. Is it that rich people we tend to have to live a very good life than the poor people that disease normally take a death toll on them? That doubt is there. That confusion is there. We don't have the data to prove whether it really happened that way. But from using our human social context or human analysis, somebody will say those with little or advanced knowledge will tend to have a good life than those with nothing or don't have anything. So thank you. Questions and answer.
Thank you very much, Mr. Sam. That was very educative. Like, for example, there are some of us here who are doing other courses like biology. Some of us are doing economics. Some of us are studying various courses, but then we are kind of wondering after my undergraduate, what should I do next? So I guess today's session was an answer to most of these questions, and
Exactly.
we are very glad to have you. So, like you said, question and answer. We'll take questions. This time around, please let it be a bit of gender equity. Please, the female ask
So
questions.
I can stop sharing, right?
Yeah, if you can, if you want to.
Okay.
So, guys, this is the time for us to interact and ask as many questions as we want. I guess with that we will learn a lot, or we will be able to cover up things that were not mentioned in the presentation. Kimo,
Hello. Alasan. Hello, Alasan. Musa, are you there?
yes, I'm here. Just open your mic and ask your question.
I don't have a question. I just wanted to add like need a contribution, but I don't know that should be done after question answer.
Yeah, after the questions.
No question for now. Contribution.
Yeah, hello,
Yeah,
Hello.
John.
hello.
Oh,
Yeah,
Yeah,
Roland.
John.
John Keselich, yeah, I got a question.
Okay.
Yeah, Mr. Livingston talk about the public health approaches, and whereas he talk about the public health model and the medical model. So,
Okay.
from the from this perspective, which model, the clinical model and the public health, because like the public health model, we talk about promoting, preventing, and prolonging life. So, which methodology is, you know, highly acceptable for the lifespan, longevity of the lifespan of an individual?
All right. Thank you, John Jala. So the public health versus clinical, I told you both work hand in hand. They are not in isolations of the other. The public health is mainly looking at longevity. People should live long. It tells you things that you should be able to do. Clinical health will look at a single individual to treat their disease condition for them to live long as well. So both work hand in hand, but what is better to save our earning is us looking at the public health aspect. Because if you take the component of the public health aspect, the free money that is supposed to be spending in the healthcare sector will be saved to be used for different purposes.
All right. Any other question?
Okay, thank you. Yeah, another question.
Okay.
John
Okay.
Chala again. Yeah, basically, Mr. Livingston talks about the major discipline in public health, and my attention has been drawn to nutrition. Uh, just an inquiry: can we safely say that prioritizing fruits and vegetables may increase the lifespan of many Africans than like eating to live and living to eat and stuff like that?
All right. Thank you. You know, many at the time we even try to play with the food that we have around here. If you look at nutrition, I just want us to think balanced diet back in elementary, junior high, and high school. So it is not eating everything, but it is eating bits and pieces of those things. We have banana, we have apple, we have pineapple, we have a lot of fruits around all that we can eat to balance our diet. So eating a bit and pieces of the food that we can produce locally would be best and better to increase or to make sure that we have a bit and pieces of all of those things to make sure that we live longer. So if you are lacking those small fruit, you may let it be suffering from certain how you call it vitamin deficiency syndrome. Maybe somebody will say if you needed to eat this food, when you eat this food, you will get vitamin D or vitamin K, and you are not been eating it, it causes you harm. So yes, bits and pieces of the fruit around us, let us make use of it. We should not try to, for those of us in Africa, we should not try to westernize our idea. Let us eat the locally made thing that we have. The walnut, the wild fruit, we can eat it. Those things our people eat it, and nothing ever happened to them. We can still eat them today.
Thank you very much, Mr. Livingston. The reason I asked the question is that many a time people get sick and then go to hospital taking drugs and things, but I have I have been told that uh, too much of taking in drugs, though it treats and cures, but it has slight effect on the health of an individual.
So let me just place it this way. I'm not saying that to make you scared. Every other drugs that were ever created has side effect. And every side effect had a treatment. Every treatment has side effect. It would be better if we can look at the public health measure component, focus on the fruit, than the too much drugs. If you do pharmacology in any of your field, when you take drugs, there are two things it does to your body. The drugs do something they call pharmacodynamic and pharmacokinetic. What the drugs does to your body and what the body does to the drugs. So yes, thank you again. Hey Roland, thank you. I'm watching you, Chief.
Thank you, bro.
All right. Um, Another question? Samuela, you can open your mic and ask your question.
Yes, sir. Good afternoon.
Good afternoon.
I want to ask a question concerning pills, because the presenter was talking about pills. Excuse me. Yeah. Injectable. Is it advisable for someone who has not given birth yet to take pills or injectables? Hello?
Yeah, hello. I'm coming a little. You remember what I said? Uh, yeah,
Yes, sir.
yeah.
Did you
So
get it?
I got the question. The essence of injectable in how you call it as one of the measures in public health is for you to control. Let me come this way. Any attempt, any action, any initiative taken by any individual to know and make sure they want to have limited number of children that they want to have is family planning. They have other methods that you can go by. In family planning, you will have more than 12 different methods, but it will be good for you to take the one that best suits you. Mind you, we all got a perception. If the traditional belief, the religious belief, and the cultural belief we have, we take it into consideration, it works for us. So take the one that works for you best. I've seen people who were not, how you call it, having children, and they took the injectable when they wanted to have children, they have them. A lot of them are working along with them here. So it's not a crime. Anyway, it's just certain component that came, but thank you.
All right. Okay, sir.
All right. Any further questions? If there are no further questions, we will take comments, appreciations, or if you have anything else to say, other than comments, maybe from at least three
I have a
persons.
question.
Okay.
Yeah, we want to thank our presenter, Mr. Sam Livingston.
Yeah.
The presentation was so fascinating, and it makes us to know that public health have started ever since from the history of humanity. Because if we look back, like in the Bible, on the Christian end, when those that used to have leprosy, it's just like maybe the manner in which they used to do it. They used to isolate them, and that is just a form of quarantine. If you look at the two diseases that we have been encountered around the world recently, that is Ebola and that of COVID-19, those two things also talk about quarantine. Because once one is infected and they are not quarantined, they may likely share with other people within the same environment. So from the presentation, I think I've learned that public health deals with not only preventing individual but also preventing the society at large. Like other cases where we have to do with ownership, that is clinical aspect of it, which only deal with individual. For example, if I get sick, I just go for treatment and I manage my treatment, go through my treatment, and it's over. But for public health, it is not only going to be limited to you. It first start with you, family, society, and the group at large. So I'm so grateful. Thank you so much for the presentation. It was really, really fascinating. Thank you.
Yeah, hello. You get me?
Yes.
Hello.
Yes, hello, we are getting you.
Yeah, I have a question.
Okay.
Yeah, okay. No, you get me?
Yes, we are getting you. Just speak.
Hello. Yeah, okay. Let me say thank you to the organizer for initiating such a unique a unique topic. You know, public health is a unique field of study. So I will advise that at least on a normal routine, you know, if at least monthly basis, 2 times a month or 3 times a month, so that we can always get involved in this activity, interaction, developing new topics so that people can be also learn because the field of public health is everyday new things. You come across new things every day. You check WHO or CDC, there are new information, there are latest information every day. So at least when you come up with a topic, different topics and things, different information about public health and things, it will actually help us a lot. Because some of us, we are at the university, we are studying public health, and this is our passion. So we are very happy to form part of this great organization. And trust me, we will work collectively to ensure that the aim and objective of this organization be fulfilled. Thank you for giving me the opportunity.
All right. Thank you very much, Roland. Actually, that's one of our volunteers at our organization. So thank you for your input. Are there any other suggestions or comments?
Yeah, John gets at each other.
Okay, John.
Just just as Roland please it we most heartily endorse such initiatives and I much appreciate the speaker man, Mr. Livingstone. He really dig deep into the topic. And I really hope that on a normal routine like Roland says, we get involved into such activities. And I hope to really, really interact with Mr. Livingstone to get a broad concept of knowledge on the field, on the field of study of public health, because this is where we find ourselves. And it's like every time research, man, every day research because public health deal with new thing every time. So we would appreciate you guys really.
Thank you.
All right, guys. Thank you. Are there any other comments for the presenter or any other suggestions? All right. I guess there are none. So Firstly, let's give our presenter a very big thank you. It was also an honor and a privilege meeting him because as a public health enthusiast, we are here because we all want to somehow get in the fight of achieving a good community health or a better public health activities in Liberia. So that's why, or in other part of Africa, that's why we all came here today to learn and listen to people from different countries and different background of health. So thanks to everyone who joining here, and thanks to our presenter for his input. He sent us his slide. We will share with you guys later. And if you want to communicate with him, I think you can always reach out to him. You can ask him for his what they call contact info and always reach out to him. For those that are in Liberia, you can even meet him because he's in Liberia and you all can learn a lot from him. He's a young person like yourself, and I think it's good for young people to engage themselves and learn from each other. Thank you very much, Mr. Sam and Livingstone. If you have any departing speech for us, we'd love it. We'd love to hear from you.
All right. I want to say thank you for affording me the opportunity to be on your platform. Like, I have one of my comrades here. He and I work on the Public Health Association platform, Roland and Wanda. So I'm seeing some guys here. We can talk, we can chat, and open up anytime you call. I will respond anytime you want to talk with me. Sometimes the only time I will not respond to you is when I'm at work busy. But after that, I'm open up for discussion. We can talk. And to you, the CEO, Mr. Kuma, thanks again. Don't hesitate to contact me on any other thing that you think I can do. I'm somebody who is well connected to other people when it comes to public health issues. So you can get to me other topics that I may not have strong strengths in. I will liaise with somebody who got a background, who got the booms to do so. Thank you.
Thank you very much. Actually, you and I have a conversation to do, but I will call you later on WhatsApp and we'll discuss. Thank you very much for your presentation. So, guys, please let's one more time watch our introductory video.
Yeah, hello?
Yes, hello.
Like some of us who want to get to Mr. Livingstone, how can we?
So I'm sending my number right now on the platform. No.
So he's writing his WhatsApp number in the platform. Roland, what you?
What you say?
Oh, nothing, man, nothing. Nothing.
Okay.
Yeah. You guys did well. You guys did extremely well. And I think interaction today will be too okay for us. On a very serious note, it will be too okay for us. Yeah, so I'm really hoping that at least on a normal routine, they should be done so that at least we can be able to get acquainted with other information as we unfold. That's what I have to say for now.
So if you are in Liberia, don't hesitate. I can call anybody in Liberia, call people in Nigeria, South Africa. We can talk. Direct and WhatsApp. I can do that anytime. Even in the US.
We didn't see it. For me, I didn't get it. Contact.
086
his number there.
086
Yeah, 086
96 91 36.
Okay,
The email is mlivingstone980@gmail.com.
Okay. 96 91 36.
Yeah.
Thank you.
All right.
Another comment?
Yeah. I have one question, man. Will there be another workshop tomorrow at this time?
Okay, so we are going to send the schedule again. We in the group. I'm going to send the schedule. Tomorrow we don't have any presentation tomorrow. We are going to work on the project tomorrow. So probably we just have like 40 minutes or 1 hour explanation. And after that, divide it into various groups, and you'll go to your various groups and discuss your project. But we'll let you know about that by tomorrow or tonight. We'll send the schedule in the group, and you can start your project.
Okay.
All right. So 1 minute, please. All right. So guys, please, one more time, let's watch our introductory video. We also want your comment or idea on it so that we can be able to improve some things.
You know that. Wanda Beredi, what's up? Wanda. Who do you represent there? Wanda, what's up?
I'm okay.
You might react to me, will.
They are sharing something with the group.
So I have to go somewhere now. I beg to leave.
Okay, no problem. Thank you very much.
All right.
I'll call you. When should I call you, please?
Again, and that's somebody who can sleep.
Okay. Then I'll call you anytime soon.
All right.
Anytime, feel free to call you.
I can leave the computer up to 2.
Okay,
I can leave the computer up to 2.
Okay.
All right.
All right, guys. All right. Thank you very much for staying with us and for watching up to the end. It's just a very short introductory video that we made because we don't want every time we have to be explaining what is our organization, but it's still under improvement. It's not done yet. We are trying to improve it. If you observe, you saw some errors in the video. It's still under development. We just want to show it to you so that you can know what we do and what we are. So tomorrow, we'll send tomorrow's schedule in the group when tomorrow session is going to start. Like I said earlier, it's just going to be a very short session, just and we'll divide you into groups. And based on that, we'll let you go in your various groups and then have some meeting, come back and meet group conclude. And then next week, Friday to Saturday, we have another session like this every day to presenter, and we'll also be having a summit almost every day. So thank you every one of you for joining us. I'm glad that you all were with us. Thank you very much.
Thank you too.
Thank you, Chief. Thank you.
Thank you so much. We meet tomorrow.